Assalamualaikum warahmatullahi wabarakatuh. Hello everyone. My name is Ayu Lisiani, NIM G28021004, semester 4, student from University of Muhammadiyah Semarang. I will her present example of explanation text entitled Dengue fevers. Dengue fever is one of the deadliest diseases in the world. In Indonesia alone, dengue fever is one of the most common causes. The number of victims who died from this disease is an indicator. Dengue fever is a disease that occurs due to infection with the dengue virus carried by the Aedes aegypti mosquito. Dengue fever's causing is caused by two factors, namely internal factor and external factor. For internal factor, namely immune system or weak immunity, weak immune system is usually found among children, especially those who have not been immunized. This immunization aims to prevent virus kind of disease from early age. So that when they grow up, person's immune system becomes stronger. Therefore, children are more susceptible to catching or contracting dengue fevers. However, it does not mean that only children are susceptible to dengue fevers, but the whole community, both old and young. There are internal factors, there are also external factors. Their external factor is the large number of puddles due to runs that scattered everywhere, such as in clothes gutters, used cans or bottles, or poor landfill facilities. As a result, these places are often used as breeding grounds for the Aedes aegypti mosquito. The symptoms that arise due to dengue fevers can also be studied, such as the following example. Number 1. Sudden heat fevers for 2 to 7 days, looking lethargic and has a body temperature of 38 degrees Celsius to 48 degrees Celsius or more. Number 2. Red spots appear on the skin, and if the skin is stretched, then the red spot will not disappear. Number 3. Sometimes experience bleeding in the nose or nosebleeds. Number 4. Pain throughout the body and sometimes also pain in the pit of the stomach due to bleeding in the stomach. Number 5. Experience vomiting blood and defecating blood. Number 6. There is an enlargement of the plasma which is identical to the increase in the walls of blood vessels. From the explanation above, it can be concluded that dengue fever has a bad impact on our bodies. A person who is suspected having dengue fever should see a doctor immediately, because if it is treated too late, life will be at stake. That's all the explanation from me above the example of an explanation text entitled Dengue fevers. Apologies if here is a wrong word in my pronunciation. So, many thanks. Wassalamualaikum warahmatullahi wabarakatuh.